And thank you for joining us. With us today is Erin Hruska, physical therapist, who specializes in pelvic health therapy with Women's Health Therapies Group at Meadville Medical Center. Erin, thanks for joining us.
Thanks for having me.
You're part of a group that we're going to be meeting today. And your specialty, this is quite interesting. It's something that maybe people have heard of, but maybe they don't know a whole lot about, but we're going to learn about pelvic health therapy. Before we do that, how'd you get into this field?
Yeah, so I worked in all the different settings at Meadville Medical Center, have been working for 14 years, and then I liked every setting here, but when I started trying to have a family, I ran into a lot of different healthcare workers that were women's health specialty. You know, went to fertility clinics, met a lot of really awesome healthcare professionals that specialized in women's health, and they made a big difference in my life, and I thought I kind of want to go down that avenue as well. So, did
you know at a young age you wanted to get into the healthcare field?
I did. I actually worked as a physical therapy aide here at Meadville Medical Center in the summers in my high school years.
So working at the hospital, you discovered this specialty of pelvic health therapy. What made you decide that that's what you wanted to learn more about?
Well, so after I met these other women's health specialty healthcare workers, I decided to start taking some courses. So I actually ended up getting specialized in pelvic health therapy. I have a CAPP-Pelvic certification through the American Physical Therapy Association. So I started with course 1 and I loved it, and then just kept going down the series of courses, and here I am. We started the pelvic health clinic.
So what does that mean for those who may have heard about it, but really they're not sure what that is? Talk about the specialty.
Yeah, so we have a women's health therapy clinic, but within that women's health therapy, we have what I specialize in is pelvic health therapy. So pelvic health therapy, it's kind of hard to define because it's a very broad population that we treat. But basically we're treating dysfunctions within the pelvis. So that could include, and you often would hear people talk about pelvic floor therapy, and that's the same thing. That would include the muscles, which is the pelvic floor of the pelvis. It could include dysfunctions of the vaginal tissue, dysfunctions of the joints surrounding the pelvis. That could be the hip or the SI joint. It could be the low back. It could be dysfunctions of the abdominal cavity. We have scar tissue from multiple surgeries, weakness after having a baby. All of that can lead to symptoms that patients are referred to me for. So those symptoms can be urinary incontinence, urinary urgency, constipation, pelvic pain, pain with sex. All of those encompass what pelvic health therapy is.
So there's a lot there.
Yes.
So how does a patient come to you? What symptoms are they experiencing? You mentioned some of those, but I would imagine some of that they might brush off and, well, I've given birth, I've done this,
yes.
Or maybe there was a slight injury at work or something that happens. But what are some things that you should be listening to your body and saying, okay, yeah, I need to see somebody?
Absolutely. Any of those symptoms I mentioned, especially urinary incontinence, a lot of people think, oh, I just had birth, like you said, or I'm getting old. I get that a lot. I'm just old, so I think that's just part of aging. And it's not. We shouldn't be leaking when we're running after our kids or our grandkids. We shouldn't be in pain when we're having intimate moments with our spouses. So I think the biggest thing I'd want people to know is that any type of thing that's decreasing your quality of life in the pelvic region, you should get referred.
One of the things that I've learned over the series, it's not just men who have a hard time saying, I need to see the doctor.
Right.
Same with women. My career, my family, there's reasons to kind of put your health, your own personal health aside. And you really shouldn't do that. So again, as you're saying, if you're experiencing any of these symptoms, you should be talking to your doctor. That's not the easiest thing to do, to bring that up.
Absolutely, yeah.
How do you have that conversation with your physician, or you just should have that conversation?
Yeah, I mean, that's tough. I absolutely think you just You should. I think it's really helpful. We have some great OBGYNs here at Meadville Medical Center that ask those questions. And so when that OBGYN asks that question, or any of your primary care physicians, when they ask, open up, because there is help out there. It's just a matter of getting referred to us.
Now, is it just for women? Are there instances where if men are having issues, they should be contacting your office?
Yeah, so we do have a women's health clinic, but I do treat pelvic health in males as well. So yeah, absolutely, males can be treated, and I do treat males with any of these same symptoms going on.
A lot of the things that we discuss come back to that quality of life, right? You're seeking to get back to the healthier life you once had.
Right.
And these are things that pop up that to some they may seem little, but they're really not. These impact your life quite a bit, and getting the treatment for it can be just a big change in your own life, and to get back to doing the things that you want to do. So don't brush this stuff off. Get a hold of your doctor and seek that treatment.
Absolutely, and that's the most rewarding part of my job is patients return after just 1 or 2 sessions even, and are amazed at their improved quality of life that they never thought was something that could be fixed or could be addressed. So yeah.
And that first step is having the conversation and meeting with you.
Absolutely, yeah.
And everybody's different, right? So you may see 2 or 3 people that have maybe this similar issue, but course of treatment is going to be different, or the exercises that go into that could be different for each person.
Yeah, so very much so. It's definitely not a cookie cutter type of therapy. Each person is different, and that's a big thing I tell them is a lot of people are nervous just to come in for that first session, and our first evaluation entails a lot of just getting to know each other and figuring out really what their primary concern is and what's really decreasing their quality of life, and that's where we start.
Again, don't brush it off. Don't say, I'll get to it down the road, or I'm getting older, so it's just part of life. It doesn't have to be.
Right.
Seek treatment. And you start by going to your primary care physician and then being referred to your office, or how does that work? Yeah,
we do need a physician referral, whether that's primary care physician, OBGYN. We get a lot of referrals from urogynecologists or urologists, anyone that can send a referral, just like any other physical therapy. But I also encourage anyone to just call our office if they have questions. A lot like to talk to me first before they come into the evaluation, and sometimes that eases a little bit of anxiety to know what to expect that first day, to know if their concerns are really worth it, and I will tell you 100% of the time they are.
So maybe a little bit of encouragement then from your office, where you can say, hey, listen, this is, schedule an appointment with your doctor, this is what you need to say.
Absolutely, yeah, and kind of guide them in that right direction.
A lot of information on the website. Can people go there
yes.
too? Okay.
Yep.
And again, call, set that appointment, and again, get back to that quality of life that everybody wants to just go out and enjoy things. They don't want to have to worry about these little things that pop up, because the little things are big things.
Yep, and they do. They turn into big things, so it's better to get you earlier rather than later, absolutely. Our hope as a women's health therapy clinic as we grow is to get more pregnancy women, more postpartum, 6 weeks postpartum women to come and see us.
That's fantastic. At the end of the day, what do you do to relax?
Oh man, well, I have 3 kids, twin girls and a little boy, and wow. They keep me busy. I think most of my spring through the summer was either at a baseball or a softball field. So my life is surrounded around them. I do like to run. I ran my first half marathon last summer, so I'm looking for my next race to come. So,
what's it like to have an impact here at Meadville Medical Center with your patients? I'm sure you see them out, and it's got to make you feel good knowing that you're able to help with the overall health of our community.
Yeah, absolutely. This job is extremely rewarding, and I grew up here in this county, and this little hospital means a lot to me, so I love to see that I can help the community in some way.
Erin, we appreciate your time, and thank you for teaching us about pelvic health therapy.
Thank you.
Again, as you say, there's a lot of information out there, and people might not know exactly what it is or what the specialty entails, but now they have an idea. And again, if it's something that is, if you recognize a lot of those symptoms and things that are popping up in your life, don't hesitate. Call the office, call your primary care physician, and get that conversation started. And don't be afraid to have that conversation.
Yeah, thank you.
Erin, thank you.